Welcome back to You Heard It Here with Dr. Gary. This is Earwax Removal Vlog number 114. Today, we're going to take a look at a patient who had an extremely impacted ear. This earwax removal took us forever. It was a doozy. This patient is a longtime patient who's been seen every year for about 10 years now. I've been encouraging them for at least 5 of those 10 years to come in at least twice a year, because coming in twice a year, it wouldn't be quite this packed up, and we'd have a lot easier time getting it removed. Be a lot quicker and more comfortable for the patient. This patient, as we look in their ear, you can see that they have this huge curve as soon as we get into the ear canal. That, coupled with the pit, or the little depression that they have in their ear canal floor, really does cause a big buildup of this earwax. Now, of course, this patient, like many of our other patients, is an avid Q-tipper, and we do counsel against using Q-tips, and we do show people, of course, on the big screen why they shouldn't be using Q-tips, but it does not seem to matter. They feel like they need to dry their ears out every time they take a shower, and that's what they use. Unfortunately, they do know that it causes this impaction by backing up the epithelial migration and making it very difficult for that wax to find its way out naturally, but alas, here we are. So as you can see, we're digging out this earwax. You can see that it's stuck to the ear canal wall and the ear canal floor. And right there, I'm actually pulling the debris out of that little pit in the ear canal floor with the curette, trying to make it so it's not stuck. If you like these wax removal videos, please take a moment to like and subscribe. It really does help with the YouTube algorithm and also keeps me motivated to put this content out. Now, this patient is also suffering from quite a bit of hearing loss and pressure in the ear at the moment, and that's because of the amount of wax that they have. They do not have a history of hearing loss. Again, we've tested their hearing several times. Very normal hearing, and once this wax is out, they feel like a whole new person. But as you can see, it's just caked to the sides of the ear canal. As we use the curette, we're trying to separate this from the ear canal wall, but it is making it very difficult to come out, and it's not coming out in one chunk. This is coming out little by little. I have had a conversation with this patient in the past about using microsuction with their ENT. This is one of those we've developed a relationship, and they just like to come in and have us do it, even though I personally think for this patient, seeing the ENT and microsuction would be a much quicker method. Now, I did not show the irrigation here. Again, I did not have a second set of hands, but we did need to run some irrigation in order to break some of this stuff off the side of the ear canal wall. Now you can see that we're using the alligator forceps, trying to grab the skin, the loose skin and debris that's in there, and also to get that hair out of the way. Now, I'm going to miss the hair right now, but I was trying to grab the hair, there it goes, so it doesn't go further down the ear canal, contacting the eardrum. Wouldn't really hurt anything, but sometimes the patient can hear it and it tickles a little bit, so we were trying to avoid that. We can see part of the eardrum, and this is starting to come through, but this wax removal has now taken probably 20 minutes overall in the office. We are giving the patient little breaks because, especially when it is this adhered and attached, it can be stressful. It's not painful, but it is definitely something that the patient can feel, and they are aware of what we're doing, so they're trying very hard to stay still, and it just causes a lot of stress. We're going to get back in there with these alligator forceps and try to grab this big chunk of skin, hopefully pulling it all out in one large chunk. Unfortunately, nothing seems to be working the way we want. You can see it just break right apart there, and now we still see that wax down there pretty deep. Remember, this content is not designed to diagnose, treat, cure, or prevent any disease. We're just here to educate and entertain. In this case, this is a prime example of the dangers of Q-tipping. It may seem like it's not the worst thing in the world, and for some people, they get away with it, but overall, Q-tipping is just going to have the effect of pushing this earwax down deeper into the ear canal and causing this type of impaction. Unfortunately, with this type of impaction, the epithelial migration or self-cleaning function of your ear canal is not going to work properly, This is just backed up way too far, and that's going to cause it to really just cause this patient to have progressively impacting cerumen. We use the alligator forceps yet again, and we're still just not getting this to break all the way free. I'm assuming that this skin is attached down closer to the eardrum, further down the ear canal, and that's why it's coming apart, but we're still trying to get it all out. Again, this patient is being an absolute trooper. This has not caused the patient any discomfort. It just feels really weird to have somebody digging in your ear for this long. Hopefully we're nearing the end here for the patient. As we get down there, we can see that absolutely that release there. So as we look back down now, we do see just a little bit of dead skin down there, but I can see the eardrum. So hopefully this will get us all the way out. You can see the moisture and how it absorbed into the skin. We're going to use the alligator forceps here to try to grab that skin that's now loose and get that out, giving us a good view of the eardrum. And then we won't see this patient again for another year, even though we are recommending every 6 months for this patient. This has been You Heard It Here with Dr. Gary. Thank you for watching. I look forward to seeing you in the next video.